Hi guys. Haven't been on for a couple days, so I thought I'd give you an update. Hi, I'm Jen. Welcome to Chat with Me. And if you didn't know, I recently had knee replacement surgery. So I'm gonna show a graphic photo. So if you don't want to see it, don't look. It's of my incision. So progress is happening. So here it is. Looks worse on camera than it does in person. But anyway, the redness you see is from that bandage I have on. I think it was called Aquacel. Anyway, it's a bandage they put on. It's a surgical bandage they put on, and they leave it on. And here they wanted to leave it on. It was 20 days till my post-op. So it was bothering me. One day I went to the ER because I looked like I had an infection started at the bottom, lower half of my leg, not at the incision place. So I went. They changed my bandage, checked out my incision. Everything's fine. So then that was 2 weeks ago Sunday. So last week on a Friday I went in and I told him I wanted my bandage changed. This was at the time I had my regular doctor's appointment. So they didn't want to do it. They said, "Oh, we don't have anybody to do that." And I said, "Well, if you don't have anybody, I'm just going to take it off myself because it's itching and burning, blah, 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 around the edges." So we happened to have a nurse or something here from another city that was working in that building at the time. So went up there to see her, and she says, after looking at it, she says, "Well, do you want another bandage put on?" And I said, "Well, yeah." She goes, "Well, I could do a dry dressing if you want." And I thought, well, no, I just think that it's just time for it to be changed. And I liked the bandage because I could wear it in the shower without any problems. So had another appointment yesterday for therapy, and it was actually burning where the outside of the bandage was sticking to me. So again, nobody upstairs this time, but they did have another. There's a clinic inside my doctor's office building, um, also run by them. So they sent me there, and a doctor said, yeah, he wanted to look at it and possibly change the bandage. So when he took it off, he says, like everybody else was telling me, you can leave this on, blah, blah, blah. And I said, no, I actually looked up the product, and the manufacturer says you need to change it every 7 days. And he says, how long have you had this on? And I told him about a week. Told him how I had it changed before. And he says, yeah, it kind of looks like it's you're breaking out from it. Suggested I take Benadryl. And I said, well, I don't take Benadryl. It interacts with my heart medication. I'm not allowed to take that. So I said, but I've been taking Zyrtec. And I also take, I alternate between allergy medications. I alternate between Zyrtec and Claritin. So, yeah, pretty itchy right now. And you can't scratch it. So I usually just do that. Yeah. Looks like it's bunch of little bumps coming up. They gotta do their little thing. Um I do have cortisone. I tried it a couple of times on a few different places on it, and it doesn't work. So, not doing that. So now I'm just put Vaseline, regular Vaseline, over my staples, and then on the outside of my skin, I did put some lotion, but evidently it doesn't like it because it feels like I need to go wash it off. It's irritated. So yeah, still having a whole lot of pain. Pain rating still at a 10. Um, so I had to have my prescription refilled for another 30 days. Um, I'm doing my exercises at home. The therapist I went and saw the other day, I was telling him how bad I hurt and everything, and we talked about it. And he actually decided that I was probably overdoing it at home. I'm not the kind of person that can just sit still. I've had to for the past 3 years because of the knee, but so when I have pain, I like to get up and move around. Well, with this particular situation, I can't just get up and walk around. I can stretch it, I can do my little therapy exercises, but as far as getting up and moving around, not doing that well. I'm doing as well as I should, but not well enough that I should be left alone. So Mike's been taking off work a lot. Um, he went for a full day today because my caregiver is going to be here in an hour. So yeah, if you ever have this surgery, everybody that I talked to that had this surgery before I went said that it's worth it. They don't regret doing it. Best thing they ever did. So I know I did the right thing. But here's what you should know before you do it. The pain is like nothing I've ever experienced. And from the people I've talked to, they have said the same thing. The pain can be really unbearable. I know one night I was like, Lord, just take it off. Just take my leg off. Because you say things, you think things, you're not really rational when you're in so much pain. My hurt felt pain. My pain felt pain. You get what I call these zingers. And it's like, it's tingly like when your leg falls asleep. But what it actually is your nerves trying to reset, they call it, after the surgery. During the surgery, they put a tourniquet on your leg, which leaves you a little uncomfortable afterwards. That's up in your upper thigh where they actually put that at. And that's just to make sure you don't bleed out or something if they hit something. So you got that uncomfortable feeling. And then I didn't have bone pain. The pain I'm describing is from tendons, ligaments, muscles, everything in there that have been manipulated, pulled apart, moved out of the way to actually access your knee joint. So that is the worst pain. After it starts to show the bruises, your leg will look horrible, as I showed pictures. It looks like your leg was mutilated, but it wasn't. But that the majority of that pain is muscle pain. It's as if you had gone to the gym and just way overworked your muscles. So the zingers I'm talking about, it's like the pins and needles. And when you feel it is when gravity grabs your leg, like when you're pulling your leg off the bed or a chair and the gravity suddenly grabs it. These zingers are like little tiny electrical shocks, millions of them going off in your leg at the same time, and they're sharp and they hurt. Um, like I said, very similar to your leg falling asleep feeling, that tingly feeling, but it's not that, and you'll quickly realize that it's not that. Um, you'll have numbness left over. Because when they cut into you, sometimes, well, most of the time, you'll get some nerve damage. Mine's in the skin area on the left side of my incision. They said sometimes that comes back, sometimes it only comes back partially, sometimes it doesn't. It doesn't interfere with my knee movement, doesn't interfere with anything to do with walking. It's just a little strange to rub your hand over that and you don't feel it on the inside. So, man, it's getting red from me rubbing it. It's right there, just rub it. There's always all these little bumps there, like a rash. So, for that, I've got this. I've got this, and that's the machine for it. So it pumps the cold water through this hose into this, which that little cooler thing holds ice and water. And when it comes through the hose, it circulates through the hose, the water, it feels really cold. So when I put that on my knee, it cools down that rash. It cools down that skin and quiets it down. When I walk, I try to walk normally. Now, what has happened, and I didn't notice this until yesterday, and when it happened, I freaked out, and then I looked it up right away, and it says it's kind of common. So I was at therapy. I was getting sore. It hurts from my leg to just hang from the seat in the wheelchair. Very well, it's uncomfortable. So, having my walker with me, I get up from the wheelchair and I'm going to walk a little bit in the hallway. And I did that. And then I stood still and realized my surgery leg was longer than my other leg. And I freaked. What the heck did they do to me? So, what I found out was they actually corrected my knee alignment. Before I had gone into surgery, when I was asking the surgeon questions, that's one of the things I had asked about. I had been knock-kneed my whole life. Not extreme, but it was enough to irritate me when I saw myself in pictures and whatnot, or saw my legs. So he said yes, he probably, he says in most cases he does correct some of those things for balance and stuff. So he had corrected mine a little bit. And it doesn't affect the way I walk or anything, but it affects the way I stand. So, do I go have the other leg done so I match up? Do I, all these questions run through my head? And after reading some people's posts and things, um, some have actually had a lift put in their shoe, depending on the difference. When Mike looked at me standing there, when we were standing in the hallway there, he said, I don't see any difference. And I said, well, come over here and touch my knees. And he says, oh my gosh, that one's up there and that one's down there. I said, yeah, I know. That's what I said. So, Yeah. If it becomes an issue, if it becomes a balance issue, or my shorter leg starts really bothering me or something, then I have to check into getting something in my shoe. I'm not really afraid about it right now because in my mind I know that that joint's how it should be, and I know before I couldn't walk on it at all. It was horrible. And after I had this knee surgery, I thought, oh my gosh, this is so much worse than my knee pain was before. Um, Maybe I shouldn't have had the surgery. Well, after I've done it and going through these different stages of recovery, I've decided that there's no way I wanted to go back to that other way. This pain is only temporary, where that pain was not going to heal itself and therefore affected my quality of life. I couldn't go places I wanted to go. It's really difficult when you're in a wheelchair to open doors, get through doorways in certain places just because of the way the building's designed, or at a store or something, they've got like a door and then another door you got to go into that. Yeah, just stuff like that. Just a pain in the brain. The positive of the wheelchair was if I was tired, I always had a place to sit. So I'm trying this cortisone stuff on this. It's not as nice as the cream is. The cream can go on and it's fine. Well, this, because it's a dauber, I think it's got some kind of alcohol in it. It'll sting a little bit. But yeah, that's what I did. I was rubbing that way too long. I thought I have to put something on it. And if this doesn't work, then I'll go in there and wipe it off. Cold water. But yeah, I'm going to try this. I go to the follow-up appointment. It was originally scheduled for the 22nd, but I got on my chart and signed up for the give me a call if there's a cancellation type thing. So that worked. I got a text yesterday saying they got me in Thursday, so that's day after tomorrow. Hopefully, I'm hoping they can take these staples out. I'm afraid it's like I don't want to wear anything. I don't want to wear bandages anymore. I don't want to. It's healing. It's becoming uncomfortable with the staples. So they're starting to like instead of being like flat like staples usually are, they were, they're kind of coming up now as the skin's closing up. So I'm afraid I'm going to catch something on them, like, I don't know, piece of clothing, or go to scratch, accidentally hit that, or forget they're there and scratch. So yeah, there's reasons I want them out. I did take the stitches out. They had 2 or 3 stitches at the very bottom, well, below my incision line. It wasn't at that. Um, and they were irritating me. Just the threads poking and everything else, so I snipped it and pulled it out. Um, no harm, no foul. Oh, I'm tired of laying in bed. Tired of the extra I can't just get up and go. I have to pull the ice machine off. I have to now my leg is very weak as far as I cannot lift it. Like if I'm laying in the bed on my back, I cannot just lift my leg up like a straight lift. So what I do is I put my right foot underneath of it and I lift it with my right foot, and then there I can swing back and forth, go off the bed or on the bed. Um, if you have the zingers and you just, while you're lifting that leg like this with your other one, hold your bad leg right next to your good leg, like tight. And that really brought down the zingers. It didn't in the beginning when it was fresh, it still happened, but not nearly as bad. And now that I'm even better than I had this April 2nd. I still get them every now and again, but it's really faint. And when I do the lift with my other foot lifted up that way, I don't feel it at all. So it does helps in my situation anyway. Um, Therapy is hard, but it's going like it should. Um, they said I am progressing at the better rate. Um, there's low, medium, and high. The way people do it. So they thought I was going to be medium because of my previous therapy sessions before I had the knee, and they said this time I'm the high level. I'm doing better. So yeah. Well, that cortisone is drying on there, and the redness is almost all gone now. I got a few little bumps, and actually, you know what I think it is? I think they're hives. Because they itch like a mosquito bite would itch. So I'm not scratching. But I am poking my fingernail in and rocking it back and forth. No scratching. I certainly don't want to put a lot of pressure on it or pull the skin out of the staples. So yeah, that's what Nettie does. Ever since I came home from the hospital, she's been like that to me. So if you don't think your animal knows, they know. Oh, nope. Now she's trying to lick my incision. Nope. Can't do that. Okay. Yep, she's in a lick me mode. Does your cat ever do that? So yeah. She's eyeballing my incision, bobbing her head. She wants to get down there. I have to get it wrapped up. It's probably the light shining on the staples, kind of shiny. She might be drawn to that. Oh, she looked away. I was going to show you her staring at it. Yeah, so not too bad, guys. Nothing really to say other than um, if you find a good surgeon and you really need your hip or your knee replaced, I would say go for it. I do have to have my right hip done. This was my left knee. Um, and now because of the extra work the right hip is having to do, it's getting a lot worse. I mean, the pain's a lot worse in it. So, not for a while. I'm not going to go tomorrow and have that surgery done. Maybe, I don't know, maybe a year and a half. I'm going to be totally healed with this knee. But they do assure me that the hip is a little easier than the knee replacement, and it has to do with the function, the difference in the function of the hip and the knee that makes it different, and that it's not quite as bad as when you get the knee done. So yeah, we'll see how it goes, and just wanted to keep you guys updated. Um, I'm doing all right. Don't worry about me. You can worry if you want to. Like, subscribe, dislike, share with your friends or your enemies. Everything's good, guys, and no matter what you're going through, it will work out for your good. Have a happy day. Bye bye.